This recorded lecture will be a brief overview of healthcare delivery systems according to the ATI Fundamentals textbook. Healthcare delivery systems incorporate interactions between healthcare providers and clients within the constraints of financing mechanisms and regulatory agencies. Components of healthcare systems consist of participants, like consumers or clients, licensed providers and unlicensed providers, also known as assistive personnel. There are various settings where healthcare delivery can occur. Regulatory agencies consist of the U.S. Department of Health and Human Services, the U.S. Food and Drug Administration, state and local public health agencies, state licensing boards to ensure that healthcare providers and agencies comply with state regulations. The Joint Commission sets quality standards for accreditation of healthcare facilities. Professional standards review organizations monitor healthcare services provided, and utilization review committees are there to monitor for appropriate diagnosis and treatment of hospitalized clients. A sentinel event is one that results in a client death or permanent or severe temporary harm. These events are reported to the Joint Commission and are tracked to help healthcare organizations improve client safety and quality of care. The National Committee for Quality Assurance is a widely recognized accreditation program that measures the quality of care based on patient satisfaction scores and its healthcare effectiveness data and information set. The HEDIS tool measures 90 different points across several different areas of care. These scores, or standards of care, are then compiled with a client satisfaction score to rate each organization. The American Nurses Credentialing Center, or the ANCC, is the developer of the Magnet Recognition Program and the Pathway to Excellence Program, recognizing excellence in nursing practice. A magnet status is awarded when organizations successfully demonstrate the promotion of quality in a setting that supports professional practice, the identification of excellence in the delivery of nursing services to clients, the dissemination of best practices in nursing service. Magnet organizations will demonstrate better client quality indicators like lower fall rates and improved skin integrity, and they have higher client satisfaction scores with improved client communication. A 4-year designation is awarded to organizations that demonstrate the Pathway to Excellence program. This shows a commitment to providing a healthy workplace for their staff. Pathway standards will focus on factors like turnover, workplace engagement, productivity, teamwork, and job satisfaction. The Pathway application and review process involves frontline staff and organization leaders, completing the application to determine if standards are integrated into practice as well as the organizational culture. HCAP scores will use a broad range of standardized questions to measure and compare client satisfaction between healthcare facilities. These are administered randomly to clients between 48 hours and up to 6 weeks after discharge. These scores are publicly reported, and they ensure accountability and transparency of client satisfaction data. The Press-Ganey survey is a popular survey tool to measure healthcare delivery and client satisfaction in acute care agencies. It contains metrics on access to care, wait times, client interactions with the healthcare team, and the visit itself. This is emailed to every client at the conclusion of their visit. There are healthcare financing mechanisms. There are publicly funded programs like Medicare. This is for clients 65 years of age or older and those who have permanent disabilities. Another public federally funded program is Medicaid. These are for clients with low incomes. There are private plans. These are traditional insurance plans that reimburse for services on a fee-for-service basis. This can include managed care organizations, or MCOs, preferred provider organizations, or PPOs, exclusive provider organizations, or EPOs, and long-term care insurance. There are different levels of healthcare that exist. We have preventative healthcare that focuses on educating and equipping clients to reduce the control and risk factors for disease. Primary healthcare emphasizes health promotion and includes prenatal and well baby care, family planning, nutrition counseling, and disease control. Secondary healthcare includes the diagnosis and treatment of acute illness and injury. Tertiary healthcare, or acute care, involves the provision of specialized and highly technical care. Restorative health care involves an intermediate follow-up care for restoring health and promoting self-care. Continuing health care addresses long-term or chronic health care needs over a period of time. There is a relationship between the healthcare systems and these levels of care. The people, the level of care for our clients will depend on their needs. The settings for secondary and tertiary care are typically within a hospital or specific facility. Settings for other levels of care will vary. Regulatory agencies will help ensure the quality and quantity of health care and the protection of healthcare consumers. Healthcare finance influences the quality and type of care by setting parameters for cost containment and reimbursement. The Quality and Safety Education for Nurses, or QSIN, assists nursing programs in preparing nurses to provide safe, high-quality care. There are 6 QSIN competencies: safety, patient-centered care, evidence-based practice, informatics, quality improvement, and teamwork and collaboration. The Patient Protection and Affordable Care Act of 2010 is a federal statute that is aimed at increasing access to health care for all individuals and instituting an individual mandate for health insurance, decreasing health care costs, and providing opportunities for uninsured people to become insured at an affordable cost.